Okay, let's get started. Again, the question I'm going to ask today, there's a central question, and then there's three subcomponents of that question that are wrapped up into it. And the central question is how to find the best drug rehab, how to find the best drug rehab. And that's followed and enclosed within that question, within that question is what differentiates quality treatment centers from non-effective ones? The second one is, when searching for a drug rehab center, what questions should you ask? And finally, the question is, should you stay local for treatment or travel to find the best drug rehab available? So if you look at this, the overall question is how to find the best drug rehab. And then within that, the first two questions is, what differentiates quality treatment from non-effective ones? And then, when searching for a drug rehab center, what questions should you ask? The third question, traveling or staying at home, I will answer last. I want to remind you that the way I answer pretty much every question on this channel is I do a few things, and there's a goal here. And the things that I do is I take the scientific data, which in clinical medicine we call evidence-based medicine. So I take the evidence clinical data, and then I take my own clinical experience and practice, which is a really, really important thing to do when you read the evidence. I put the two together and then distill it out to you in a very, very easy to digest manner. So there's the science of it, and then there's the clinical experience. At times there's not much science, so I give you my answers in terms of my clinical experience. At times I may not have much clinical experience, so I will give you the answer that science tells me to do, and I may speak to other clinicians that have more experience in that area. In this case, I'm going to sort of rehash and reformulate the question, how to find the best drug rehab. And really that question I think should ask, what is the best drug rehab? And that goes on to asking, and if you know what is the best drug rehab, you know what you're looking for, and then you can find what you're looking for. And that will help with what differentiates quality treatment centers from non-effective ones. And now you also know what questions to ask when you are searching for a drug detox rehab center. So I will begin how to find the best drug rehab, what differentiates quality. You have to know what to look for. And for that, I think you need a little bit of education about all of this. I touched on some of this in my previous video, how to help an addicted loved one. And I think it's really important because I run into this issue every day. And I find it in two areas. And again, this is my clinical experience. Two areas. One, when a person is addicted for the first time and now they're coming into contact with me, whether it's through my medical clinical practice or my rehab centers, they're coming into contact with me. The whole addiction treatment thing is new for them. So that's one group, and maybe their families as well. The second group is people that are sort of been doing this runaround for quite some time. Maybe one place, two places, three places, 10 places. I've had up to 35 places, and their families with them sometimes. And I notice with both groups, whether it's the first contact or the first few contacts, or ones that are kind of been through this for a long time, I find with both groups, especially in Orange County, California, that, and this is hard for people I come into contact with to sort of take in, but I very soon, most of the time, realize that they really have very little understanding of addiction, both the paradigm and the lens that they view this as a disease, which most don't, and if they do, they don't get it. And number two, in their understanding of whether it's the pharmacology of some of the medications that's used, and especially, and I'm going to use opiates during this talk as an example, but this applies across the board. I find that they have a very, very poor understanding of the medications how it's used, when it's used, why it's used, and they also have a misunderstanding of the way the medication works. For example, every single person has a slightly different understanding of how Suboxone, the buprenorphine with the naloxone in it, how Suboxone works. And every single person I've ever spoken to is wrong about how it works. And I'm talking at the pharmacological level. But the biggest thing that I find that's really wrong with their perception and paradigm and approach to this, whether it's the new user or most of the time even the older users or the more experienced users in their families, they just don't really understand what addiction is and how it should be approached. And let me try to explain what I mean. They really don't understand that this is a chronic disease model and that's how it should be approached. They really don't understand the concepts of harm reduction. And I find even most people out there in the industry, and I use the term industry in a general way about people working in addiction, they don't really understand all of those things either. At the worst, at one end of the spectrum, let me take one example. At the one end of the spectrum, when, let's say, someone really faces their addiction for the first time, let's say opiate addiction, and their family knows about it and they come in, they really expect a beginning and an end. And I think that's a real misunderstanding and a disservice both to the patient/client and the family, regardless of how severe their disease is. And what I mean by severe is how long they've been using, how often they use. Even it's at the very beginning, I watch people really misunderstand the fact that this is really a chronic disease. So let me give you an analogy. If you present for the first time with diabetes type 1 and you go into a disease state called diabetic ketoacidosis, and you end up in the hospital and you end up in the ICU with their tube down your throat, and they get rid of all of the issues in your body and your sugar's in control, you don't just go home and say, take care, you're fixed, you never have to worry about this, there doesn't need to be much care. The person that does best is the one that really understands their disease, the family understands the disease, and they approach it in a very long-term fashion. And I think, one, the way we have kind of described addiction and sold it to people to get a quick dollar, 30-day detox, 60-day detox, 20-day detox, go home, that is one reason. Another reason that I may find, this is me making an educated guess, is I think families and the patient has a difficult time with accepting the concept of chronic. And again, if packaged and explained to the patient client the right way, they can understand, look, if a guy has a diabetic event and ends up in the hospital and you get it under control, that doesn't mean they're going to have another diabetic event or even die from complications secondary to diabetes type 1 or type 2 if it's managed correctly and if they're educated. And they can have episodes where the disease might get worse, but being educated, they can jump on it right away versus being blind about it and have a sort of a cognitive dissonance from the reality of substance abuse, in this case, opiate abuse, have a complete disconnection and misunderstanding of the medications and how they're used, where your odds are having a problem later just goes up significantly. Let me give you two examples. Sometime back, I had a mother bring in a young patient, and he was, I think, maybe in his late teens or early 20s, and his girlfriend, who she had sort of adopted as a child. And they had both been involved in opiates for some time, not very long. And somehow they came to my medical practice And they became very stabilized very fast on buprenorphine type medications. And they continued that way for, I think several months. And I think one of the dangers there, as much as I attempted to explain to them from early on that we need to take care of this for quite some time, and these are the markers that we may be looking for, they really felt confident and secure in their future. And they were wrong, and they stopped showing up, and they thought they could get off the medication. And I think, I don't know how well he is doing, but to the best of my knowledge, the young lady ended up getting worse disease, and the last I heard, it wasn't good the way things were turning out. And it doesn't have to happen that way, and it's important to continuously be aware of what this thing is. So really, I think what I'm trying to say overall is when you say how to find the best drug rehab, what differentiates quality treatment from non-effective ones, the first question is, what is drug? What exactly is addiction? What is substance abuse? Now that I understand what it is that's needed, the correct medication, the correct understanding of the medication, being educated about the medication, and being educated about the disease, its long-term potential, and what kind of care is needed. If this is done right up front for the parents and the person involved early on in their addiction, we're doing a few things. Expectations are appropriately set. The treatment can be judged in that, is this the right evidence-based, dignified, patient-centered type of treatment that I deserve as a patient? And number 3, it saves a lot of psychological and financial resources, because most people basically go from one program to another and spend a lot of money and are back on the street. I just had a patient call me that I kind of came across a few years ago, and I was attempting to tell this patient, look, come to the office, get it straight, follow up, and sometimes they're just not ready. And here he is, and he was telling me he has been in a very well-known treatment center 4 different times. Okay? Well, that costs a lot of money. If he's really educated, and he may have been, and maybe he just was not ready for the change. And that's another component. There's nothing that could be done unless if the patient is ready to take that next step. This is, you can't force somebody into taking their insulin if they're not ready or don't want to. This is no different, except part of the disease is not being ready or wanting to, which adds another layer of complexity. And this is where the concept of harm reduction and the art of medicine and care comes in, because you have to be compassionate, non-judgmental, and have your doors always open, because at some point that patient will come back. So there's a few components here: understanding what the disease is and what are the outcomes if treated right. And number 2, approaching this in a way where the patient is the center of attention. They are given autonomous dignity and respect, and the tools for care to care for themselves instead of being what to do. And they need to understand this is a chronic disease, which doesn't mean you're always going to be suffering from it. That's not what it means. It means you could always suffer from it, and it could get worse, but if you take the right necessary steps, it could get better. And so now we can actually ask the first question, which is, under the title of How to Find the Best Drug Rehab, what differentiates quality treatment centers from non-effective ones? Really simple. You have to see that if they are approaching this as a chronic care disease model, they're not telling you everything's going to be okay in 10 days, 30 days, 15 days. And in fact, what they should be telling you is not you should go out there, and I have nothing against 12-step programs, but not you should get some care after you leave here with 12 steps, but this is a chronic issue and you should get the care that's necessary. So A, they should be telling you what this disease is. B, they should have an understanding and support medication-assisted treatment. Why? because your judgment as a professional healthcare provider should not play into this. It should not be, I don't like this stuff, it's another crutch. The only thing you care about is the data that shows you this stuff saves lives. I need to educate them about it and give the patient and the family the option. And so that's another component. They understand the disease. They understand the medication. They support evidence-based medicine and the chronic disease model. They have at least an intuition for harm reduction, which means it puts you at the center of care as the patient, that is non-judgmental, meets you where you're at, gives you autonomous decision-making after education, and finally, doesn't tell you to go follow up somewhere or go into 12 steps, but they either have some sort of a program that supports everything I just said in the long run, and or they refer you to either a program or an addiction specialist or whatever the intensity of care that's needed after you are discharged. And finally, when searching for a drug rehab center, what questions should you ask? Well, you should ask those questions that shows whether the program or the center or the physician looks at this as, hey, do you think addiction is a chronic disease? What does that mean to you? Do you support medication-assisted treatment? And you can't, obviously, if you ask someone, are you judgmental towards a patient, or do you meet them where they're at? And everyone's going to say no. But, do some research about what the universal concepts of harm reduction are, and see that the program supports that and understands that at a professional level. Let me give you an idea of harm reduction here and taking a patient where they're at. I recently had a pain patient who happened to be on Dilaudid, large doses of daily prescribed Dilaudid, and he was also on large doses of ketamine. And he was describing to me on the day that he left his pain clinic and was looking for an alternative source of care. He called multiple places and for the Dilaudid issue, and not one single program or physician would take him because of his ketamine. And that could be for various reasons. So one, ketamine is a substance of abuse. Two, most programs aren't going to even understand how to manage that medication, and most physicians may feel uncomfortable with it. So A, they're concerned about the potential for abuse, and B, they just aren't comfortable with this medication and handling it. Again, you got to meet the patient where they're at, and you have to kind of slice it where it needs to be sliced so you can meet them at their level of care. For this particular patient, although the Dilaudid was not relieving the pain that he was having, the ketamine was to a great extent. So he sort of needed that ketamine, or at least in his mind, he needed that ketamine. So nobody would accept him or take him, but I did take him, and I was very comfortable both with managing the ketamine in terms of its complexity as a drug, and two, I was comfortable because I knew I would follow any sort of abuse potential elevation while I was treating this patient. And so I took him. So that's what I mean by harm reduction. If you're interested in more topics related to this video, please press the video above to my left. In addition, if you're interested in other topics related to addiction, please press the subscribe button and the bell button. We really appreciate your support in our nonprofit endeavor.